You ready?
I'm born ready. Let's do this thing.
Born ready.
This is Roadmap to Retirement. Tune in for financial tips, investment strategies, and smart money moves to supercharge your retirement savings. Alex Neri, CFP, and guests are here to help you build your roadmap to retirement.
All right. Welcome to the Roadmap to Retirement podcast. Cole, I'm going to let you do your own introduction, but you're the health insurance guy. Is that right?
Yeah, that's what I've been dubbed as. I always grew up knowing I wanted to be a health insurance and Medicare expert. And that's just what I felt passionate about. Elementary school, somebody asked me, do you want to be a firefighter, a police officer? I said, no, I want to be a health insurance expert. And I know that my success will finally culminate when I get to join a podcast with Alex Neri. I've made it, I guess is what I'm saying. Yeah.
That's a big deal. You finally made it, which is awesome.
Right.
Yeah, it's I don't think I'm in a career that I would have thought I'd be in when I was 10. Nobody really wants to be a financial advisor or health insurance. Good careers nonetheless. So yeah. Maybe we start there.
Yeah. So I didn't actually grow up wanting to be that. I think I was somewhere between professional baseball player, professional hockey player, basketball, and an F1, like Formula One race car driver, all of the above. At least I think Formula One, I'm probably a little too tall for it, but I think that dream's still alive. I could make that happen. The other ones, ship sailed. But no, I got into health insurance and Medicare by accident, honestly, where I knew someone who was in the space and we had been ships passing the night. We knew we were going to work together at some point. And I've been now through that relationship, have been in the health insurance Medicare space for the better part of the past 10 years or so. And so it's been really cool. And I never thought that I would be here, but I really enjoy it. I think the things that keep me fired up about it is that there are so many people that do not understand health insurance and Medicare. And so we'll unpack some of that today. There's so many people that don't understand it. And the United States as a whole, we don't have a great program that allows us to have like healthcare literacy, to understand what a deductible is, a copay is, what my premium is that I pay. If I go to the doctor, what's it going to cost me? Is that different if I have an HSA plan or not? So like all of these different parts and pieces that come together is what keeps me excited about being in the health insurance and Medicare space. It is always changing, but that's how I got here. It wasn't necessarily on purpose, but once I got here, I felt a lot of purpose, if that makes sense.
Sure, that makes sense.
And that's how I got to where I'm at. I really enjoy what we do. Move Health as a whole, the company I co-founded, we serve financial advisors and their clients with healthcare planning as we have deemed it. And so that means folks that are in transition. So this could be early retirement before 65. What do I do for health insurance from 58 to 65? This could be a transition to Medicare. This could be a move to entrepreneurship. This could be someone who is moving to consultancy or things along those lines. And so our name, Move Health, very intentional. We help people to figure out what health coverage looks like for them in periods of transition. And so we don't ever want health coverage to be something that holds somebody back from making a move. And so hopefully that's a helpful overview.
Yeah, that's pretty good. You mentioned people go to the doctor. They don't know what to expect. They don't understand how their health insurance works. I think that's always my experience. Yep. And I think I know more about this than the average person, but it's confusing. I think the normal average person off the street has no idea what they're going to pay when they walk in. I'm the same way, but if you get a surgery or something like that and you don't know what it's going to cost, I've got friends that are having kids and they don't know what the bill they're going to get from the hospital after the baby's born is always a mystery. So there's definitely some room there for enhanced health insurance literacy, we'll call it.
For sure. I think that's what it's not often I get to do in-person conversations with either advisors or their clients. But when I do this exercise where I have everybody raise their hand if they know what their current deductible is. And it's always pretty eye-opening to have a whole bunch of, sometimes it's a room of financial planners who are incredibly intelligent people, trusted with leading people through retirement. They don't know what their current deductible is, right, on their health insurance. And so our goal as Move Health is to improve healthcare literacy, to help make it, our mission statement is to make health coverage simple and clear. But that's what I feel passionately about, it is helping people to understand, hey, you don't need to be concerned about what your health coverage is going to look like. You just need to understand how it works. And so I think a lot of times just, if you see a dark corner and health insurance is over there, if you just turn your flashlight on and can kind of look over there, it becomes a lot less scary. It's not the boogeyman that we all think it is.
So I guess there's two main categories of people I thought we'd discuss today. One you already alluded to is what if I retire at age 62, but I don't get Medicare until 65, and now I have to go out there on my own and buy health insurance. So what does that look like? And then the second category of people is the entrepreneur, the self-employed person, people like myself. Right now, because I'm in New York State, I go out to the health insurance exchange and I pay $660 some odd for health insurance, even though I'm young, healthy, no medications, but it still costs me that much. So where would you prefer to start? Do you want to start with the entrepreneur or the retiree that's not Medicare eligible?
Yeah, I think there's we could go either way, but let's start with the entrepreneur side of things, right? There's going to be some similarities between both of these, but there's a little bit more nuance maybe in the early retiree side of things. So as the entrepreneur side of things goes, you know this, you've experienced it. You say, hey, I've made the jump from a job that maybe provided me health coverage. 50% of the people in the United States get health insurance coverage through a job or a spouse's job. And as we think about it, that's the majority, right? And employers have been tasked with this idea of you need to provide health coverage to your employees. And so 50% of people get coverage that way. So when you make this launch into entrepreneurship, sometimes it's like the last thing that kind of gets checked off the list. And it's like, hey, I've left my employer, and you don't even really think about it. You're like, that's how I access health insurance. What am I going to do?
There's people that they won't leave their job because of health insurance. I would start that business, but I need health insurance, which I think is how we started talking. Is I think that's insane.
Yeah.
Like the risk reward, the reward for starting your own business is so much financially greater than the $700 you're going to pay for health insurance premium. Pay that premium, and probably make it up pretty quick.
Yeah, it does. It can certainly sting, though, when you're used to paying your $100 a month, $50 per pay period for your health coverage through your job, and then you get stuck with $700 a month. That can sting a little bit, especially when you are starting a business. You might be a little strapped for cash flow, all those things. But all of that to be said, it's one of those things that, like you mentioned, if you're starting a business, you're an entrepreneur, you're betting on yourself already, right? So you're betting on yourself. You're saying, man, I know that I can do this. I know I can accomplish this. I know it's going to give me freedom, earning potential, all of the things that exist. And so health insurance, Medicare, but health insurance in this instance specifically, shouldn't be a blocker to that. And so there's a lot of different options that you can look at as someone who is launching as an entrepreneur. And so these are somewhat similar to what's available to an early retiree, but we're talking about just pre-65, what the options are that are available to someone. Option one is if you leave a job that provides you with health coverage option, you can elect Cobra. So Cobra is not a health insurance plan itself. It's actually just a continuation of benefits. And so this allows you to keep your employer plan. But Alex, I don't know if you looked at what Cobra was through a previous employer, but typically it's very expensive because you're not only paying your employee portion that you paid while you were employed, you're also paying the employer portion. And then insult to injury, you also get to pay a 2% administrative fee. So you're actually paying 102% of the total plan cost. And I think the highest Cobra premium I've seen this year was $4,700 a month, which is, if you do the math, that's over $50,000 a year. So
that's gonna be a family plan. How does that?
Yeah, it is, and it can vary.
Not paying that much for your health insurance.
What's that?
Like your employer's not paying that much for your health insurance for a single person, especially.
Yeah, for a single person, that was a family of four, but in an expensive state, and that's the highest one that we've seen. But typically, if you think about someone who might be single, starting a business, your Cobra premium might still run $800, $900, $1,200 a month, dependent upon the specific plan that the employer has and how much they're paying on your behalf, et cetera. It can be expensive. So there's Cobra, that's an option. You can also look at the marketplace, right? So Alex, that's the route that you went. You're in New York, so there's limited options in New York outside as far as like underwritten health plans. It's mostly the marketplace is your option in the state of New York. But as you go outside the state borders there's also options where you can still get a health insurance plan that is medically underwritten. So it'll take into account height, weight, prescription drugs, things like that. And those plans are available, but you have to medically qualify for them, right? So there's options there. Sometimes if it's a high income earner that's healthy, you might be able to look at those and say, that's an option. Those are different state by state because each state has different insurance regulations, all of the above. So that's an option. The marketplace is an option. Cobra is an option. And then the other piece is you might have a spouse that has coverage through their job. And so if you've got a spouse that's still, if you've got a spouse that is still working and has coverage through their job, you can sometimes, if you launch a business, you can jump over to their group plan as well. And that can happen mid-year when you have that qualifying life event of losing coverage through your employer.
Sure. Yeah, that's hard to beat if you get the spouse's plan, but so why is this so different state to state? This might be like a political question. This might be something that isn't in your wheelhouse, but why is New York State so mean to me? Should I move somewhere else?
I always tell someone in New York, I said, you can thank your state legislature for your healthcare costs. New York is unique New York. I was doing that for my vocal warm-ups before we started the podcast. Okay. But
lots of Ron Burgundy. Sure.
Yeah, exactly. So New York is unique in the sense that the state has said, hey, we've got a state-based marketplace, the New York State of Health, right? And so you go to this marketplace to buy coverage. And they've said effectively, other health insurance options are not allowed. So the Affordable Care Act was something that the Obama administration wrote into law in 2010, largest piece of healthcare legislation ever written. All that to be said, it made some significant changes to how health insurance is purchased in the United States. One of the things that it did is it created this thing called the marketplace. And so the marketplace is where you can buy health insurance coverage without any health questions, right? And so you could be undergoing current cancer treatment and get health insurance coverage so long as you have a special enrollment period or qualifying life event. So they can't rate you they can't rate you based on pre-existing conditions or height, weight, things along those lines. So what happened when the Affordable Care Act marketplace rolled out is there's federally facilitated marketplaces. I'm in Indiana. I'm in one of those. So the federal government controls that. There are state-based marketplaces as well. New York's a state-based marketplace. And so they get to abide by the federal rules, but then also add some of their own state rules in there as well. And so they've said, hey, with that, outside of employer coverage, which is required to be Affordable Care Act compliant, the only plans in the state of New York that you're going to be allowed to enroll into is going to be through the marketplace. And so other things that are unique about New York is that they don't age band on the marketplace. And Alex, you're a healthy young guy. I'm going to make a stab at age and say you might be somewhere between 28 and 35. And with that, you are going to pay the same amount as a 64-year-old, right, on the marketplace in New York. So they don't age band it.
Being young and healthy hurts me, but then also there's an income factor too. So if you're below a certain income threshold, you get a supplemented, which I'm not saying is right, wrong, or indifferent, but it does mean that young, healthy people with good careers end up paying more to supplement people that aren't earning money and have pre-existing conditions and are old.
Sure. Yeah, I think that's one thing that's unique. Other states, your rate does typically, it's only on the marketplace. In Indiana, for example, where I'm at, it's rated for the marketplace, it's rated upon your age, your location, your income, and what if you're a smoker. That's the only thing that they can rate you up for is tobacco use. You've got that age piece in there. New York doesn't have that. They said, hey, we're not going to age band. We're just going to give everybody the same rate. And that also means that plans in New York are expensive because you are now across the board. You've got a pool of healthy young people, not healthy young people, older folks that are healthy, older folks that are not healthy, and you can mush them all into one pool. And so with that, when the Affordable Care Act was passed, premiums went up precipitously, right? Because these carriers were like, we can't underwrite health insurance plans in the state of New York anymore. Guess what? We got to put everybody in the highest risk pool. And so that's where they put everybody. It leans back into what you were talking about as far as that subsidy, the advanced premium tax credit, which says based upon your modified adjusted gross income, you can actually receive a tax credit that actually subsidizes your premium. And that actually probably leans into pretty well like the retiree conversation if we wanted to pivot there, but
Sure,
I don't want to pivot too soon.
That's next.
Yeah, there's a lot of times where somebody, and this is what we do a lot of at Move Health, is there's a lot of times where somebody will retire. Alex, you lead people through this conversation. Maybe they were someone who was $150,000 a year, $200,000 a year income when they're working, but then when they retire, that income is going to drop, right? And you're going to begin pulling income from different places and things along those lines. And those advanced premium tax credits, which were in response to spiking healthcare costs, these federal dollars that are available based upon your modified adjusted gross income, you can manipulate, massage, whatever you want to call it. It's all above board, your modified adjusted gross income to actually take advantage of those tax credits. And so for an early retiree, they might have been a $200,000 adjusted gross income earner last year, but in their first year of retirement, maybe that MAGI goes down, right? And maybe what they're bringing in as far as income goes down. And then maybe you can pull from a couple different non-taxable sources or cash reserves, and you can keep their MAGI really low and actually take advantage of lots and lots of tax credits. And I know you better than I do on the distribution of where those dollars can come from and what also contributes to that as well.
Sure. Yeah, there's a lot to get in. Gets into the Medicare conversation, we get to RMO and everything else. I think it's interesting too. So we talked about how there's people that won't start that business or take that career leap because they have that security of health insurance with their employer. In the same way, I see retirees every day, or I guess not retirees, pre-retirees every day, that are otherwise ready to retire. They've had the fulfillment they need from their career. They don't want to be there anymore. They've done a great job saving. They have plenty of money. They can afford to retire. And even though they can afford the health insurance premium, they don't want to pull the trigger before 65 and retire because like psychologically they don't want to spend the money on health insurance. And it becomes a conversation about, is it really worth giving up 2 years of your retirement to continue to work when you have the money to pay it? Are you better off pay the money, do the thing, and then go spend time with your grandkids? Like, our goal here isn't to die with $1 billion. You've got plenty of money. It doesn't feel good to stroke a check for $662 every month. But luckily, you have young people like me that are supplementing it, because really, your insurance should cost that much, or probably more.
Sure. Maybe it should cost more. Who knows?
It should probably
But
cost more. If I'm paying too much, someone's paying too little.
Yep. I think you hit the nail on the head. There was a financial advisory firm, maybe you saw it as well, Alex, they created this commercial that was maybe an early retiree, someone just pre-65, maybe 58, 59 years old. And they're sitting at a soccer game, like a kid's soccer game, and they're talking on their cell phone, and they got like handcuffs on. They got these handcuffs on and they're talking on the phone. And he drops his phone. He like looks right at the camera and he goes, "But they're golden," and holds up his handcuffs, and they're golden. There was another one where it's a guy on the beach and he's got a computer and is typing with his handcuffs on. And he goes, "They're golden," right? And so there are these golden handcuffs that keep you at your job sometimes, which is a lot of times it's health insurance, right? And even if we like zoom out as a whole, the retirement date or the retirement age that we have associated, you go into what's the default retirement age? 65. Why is it 65? It's because it's when you get health insurance, right?
Yeah,
and
historically, Social Security.
Exactly. And Medicare starts at 65. What about all these people, these 40 million people between 55 and 64 in the United States that would love to retire, but don't know what to do for health coverage, right? So that's what we feel really passionately about unlocking. What I feel really passionate about unlocking is helping advisors and helping their clients to understand, hey, there's these things called advanced premium tax credits that exist. You can manipulate, massage, modified adjusted gross income to actually take advantage of these tax credits and lower your health insurance costs. Improve your health insurance literacy, right? Understand what your costs are going to be. Plan for what these costs are going to be. You know, what I say all the time is there are a lot of really good reasons to delay retirement. Health insurance is not one of them, because, you know, what I tell anybody is like, you can always go back to work if you need to. We don't want to do that. Nobody wants to live the Walmart greeter or whatever it is that you see all the time, but nobody wants to live that reality. But there's a lot of times where people will say, hey, I've got these golden handcuffs. I've got great health insurance. I'll just work 2 more years until I hit 65 and can get Medicare. What could happen in those 2 years, right? You might have grandkids you want to spend time with. You might have hobbies you'd love to pick up. So what I'm saying here is like, you can't buy time. And so you have to be able to put a price tag on what is that 2 years of my life worth or 4 years of my life worth.
Also,
is it worth
objectively the best 2 years? There's things you can do at 62 you can't do at 72 for most people. So
Sure.
the
Exactly.
early years of retirement are the ones that you really want to enjoy. So the more early years you can add on by retiring a little bit sooner, it's probably worth it. And we don't need to beat the horse, but yeah, health insurance should not be the reason that you don't do that.
Yeah, I think that, and it's just one of those things that, could it be that health insurance is a huge expense in retirement? It could be, right? We tell people that as well. It could be a huge expense in retirement, but guess what you need to do for a huge expense in retirement? Plan for it. You just plan for it, right? You just got to plan for it, right? And there's ways to optimize and all those things, but you just have to plan for it, right? And that's where a good financial planner comes in, is just being able to say, hey, we've planned for this. We could afford $3,000 a month in health insurance for the next 5 years until you hit 65. It's not going to be that, but we could afford that. So you just plan for it. Yeah. So there's a lot of ways for an early retiree to access health coverage, and it should not be the blocker to actually get to that next move.
Yeah, couldn't agree more.
Yeah.
We are coming up on our time here. We try to keep this brief and all that.
Of course. Yeah.
What else do we want to cover?
Yeah. So I think we've talked about kind of what that entrepreneur looks like. It's a point where health insurance, don't let it be the last thing that you think about when you're going to launch your business, right? Make certain you have a plan in place, whether that's jumping onto a spouse's coverage or accessing it through the marketplace or through other means. Maybe it's taking Cobra for a little while if necessary. The other thing is on the early retiree segment, making certain that you just plan for it, right? You just plan for what these costs may look like. Know that advanced premium tax credits exist. Know that a lot of times there's this assumption that if you have to get health coverage outside of a job, that it's going to be really expensive and really crappy. That's not the case either, right? You can get good health insurance outside of a job. But I think the other piece is, don't assume that your employer plan is the gold standard. Sometimes we find that transitioning to the marketplace actually provides somebody better coverage. on occasion. And so there's times where that will happen for an early retiree. Don't let it delay that next move. So I think that's important. Just inform yourself and plan for those costs. Be educated when you're making those decisions. I think we probably could cover off on Medicare if we wanted to go 65 and older for a little while. I don't know how much time we've got, Alex, how long you want to go, but we could talk on Medicare for just a little bit.
Let's do the 3-minute Medicare conversation. So what do we want to know about Medicare? Maybe we do as simple as, when do you file? What does it cover? What doesn't it cover? And what does it cost?
Yep. Okay. Here we go. 3 minutes. Start the clock.
Yes.
Medicare. So Medicare, founded in the 60s, is a federally funded program for those that are over the age of 65 to insure them. You pay into Medicare your entire career, or your spouse's entire career. So as long as you work your 40 quarters, typically you get Medicare Part A premium free. Medicare Part B carries a premium, right? So Medicare Part B, you pick that up, that carries a $185 a month premium in 2025 as the standard premium. That fluctuates and changes annually. Usually it goes up, doesn't usually go down, but it's $185 a month right now as your Medicare Part B premium. Medicare Part A and B make up what's called original or traditional Medicare. And so Medicare A and B, they're going to cover 80% of your medical costs. A covers hospitalization, surgeries, inpatient. Medicare Part B is going to cover labs, outpatient, things along doctor's visits, things along those lines, but they cover 80% of your healthcare costs. And then there's this 20% that is not covered. And then that's where you have to pick and make a decision between Medicare Advantage and Medicare Supplement. Medicare Supplement typically carries a monthly premium. There's different plan names for those Medicare supplements. Plan A through N. Plan G is the most popular and comprehensive that's available to folks turning 65 nowadays, but there are a lot of different options. That is also known sometimes as a Medigap plan. Why? Because it fills the 20% gap. And so that typically carries a monthly premium. For a Plan G, it's anywhere between $100 and $220 usually for someone turning 65 per month. And so we would look at what those would look like with somebody. The other option to fill that gap is Medicare Advantage. Medicare Advantage takes your Medicare Part A, Medicare Part B, prescription drug coverage, mushes it all together. And you now the insurance carrier that your Medicare Advantage plan is with is who controls or tells you what doctors you can see, things along those lines. And so sometimes you'll hear a Medicare Advantage put into a negative light because it'll tell you like, you can't go see this doctor or this and this and this. That is the case, right? On occasion where you've got a network that's associated with it, whereas a Medicare supplement works alongside traditional Medicare and has an open network. As long as the doctor takes Medicare, you can go there. A Medicare Advantage, you might have to stay within a carrier's provider network. And so Medicare Advantage typically doesn't have a premium, but ropes in drug coverage and those things all into one thing, creates predictable costs, but it does sometimes limit your access to providers and things like that. That's the decision point at Medicare. It's built for those that are over the age of 65 or those that have become disabled prior to 65. You have to make a decision point between Medicare Advantage, Medicare Supplement. There are some rules and regulations. Again, New York's another unique state for Medicare on making the right decision around what Medicare Supplement plan to choose or Medicare Advantage plan to choose from the jump. But it's certainly a decision point, something that you need to talk to an advisor about because you've got Social Security that's in that equation. You've got tax that's in that equation. You've got IRMA that's in that equation. You've got health coverage that's in that equation. And it's this point, 65, where a lot of different things culminate. And it's important to make certain that you're talking with somebody that you can know and trust when it comes to that.
All right. Love it. So today we learned move out of New York State.
I didn't say that. I was
going to come get you. All right, cool. Covered a lot of stuff. Cole, thank you for being here. Thank you for doing this. If people want to get a hold of you, how can they do that?
Yeah, Alex, they'll route through you. That's the benefit of working with Move Health is we want your advisor or an advisor to get that client over to us because a lot of times, whether it's early retirement or Medicare, there's some unique ties, whether it's modified adjusted gross income planning, pre-65 for those tax credits we talked about, or if it's IRMA planning for Medicare, if you're going to be a higher income earner, how do all those things work together? Am I taking Social Security already? Am I not? A lot of times a financial professional is involved in that conversation. So we always like for a client to come through an advisor. They can learn more about us at movehealth.io. That's our website. So movehealth.io. And that's what we do. We think it's an important piece of the retirement or launching entrepreneur or Medicare conversation is to make certain you're working with someone who's giving good, objective advice and guidance to what you all are, to what they're going through as far as healthcare planning.
Okay. Love it. Thank you for being here. We'll end it there.
Of course. Thanks, Alex.
Nailed it.
Securities and advisory services offered through LPL Financial, a registered investment advisor. Member FINRA and SIPC. The opinions voiced in this podcast are for general information only and are not intended to provide specific advice or recommendations for any individual. To determine which strategies or investments may be suitable for you, consult the appropriate qualified professional prior to making a decision. Individual tax or legal matters should be discussed with your tax or legal professional. Our Craven is not affiliated with or endorsed by LPL Financial or Cultivate Financial Planning.